Hi, today we're going to be doing procedure 31-3, collect a sputum sample. So for this, you're going to want to make sure that you have doctor's orders and that you correctly identify your patient for needing to do this test. So to start the test, you need to wash your hands, which I have already done, but I'm going to go ahead and put some gloves on to protect myself and the patient. The only equipment that is needed for this test is some water for the patient to rinse their mouth out with, and their cup for their cup so that they can get their testing completed at the laboratory. Usually it will come with a lid. However, I don't have a lid, so we'll just have to pretend. And it does, however, we did make a label that has the patient's demographics information on it, so that the lab can accurately and identify the patient and the correct specimen for that patient. So, what is your name?
My name is Riley Deck.
And your date of birth?
My date of birth is June 13th, 2010.
Hi, Riley. My name is Felicia, and I'm going to be your medical assistant today. Your doctor requested that you get a sputum sample done. So can you rinse out your mouth with water for me so that we can get the test started? Okay, here's your water. Okay, so while she is rinsing her mouth out, basically the procedure is so that the doctor can see if there's any infection in the lungs, and they can see through the sputum what is going on if the patient is having those types of difficulties. It's a fairly simple test. However, you have to make sure let the patients know that they don't need to cough from their real high up, like a gentle cough. You really want them to use their deep, low lungs so that they can get up as much sputum as possible from as deep within for the most accurate results. So Riley, we're not just going to do a gentle cough, okay? I want you to cough as hard as you can to get up as much as you can from the bottom of your lungs, okay? It might be easier if you stand for this. Let's go ahead and stand. Okay, so go ahead. I'm going to face you this way so I don't get coughed on too. But go ahead and cough. Perfect. Thank you. So now that the patient has completed the exam, you would put a lid on this to securely secure the sputum for the laboratory. And we have a biohazard bag, and so we would put the sputum sample in the biohazard bag so that it is ready for the laboratory. After this is completed, you would want to get this sent off to the lab in which your facility works with, and then that is the end of checking for a sputum sample. You can now remove your gloves, and after you remove your gloves, you'll go ahead and wash your hands and log all the information into the patient's medical record. And that is how you successfully do a sputum sample.